You are listening to the Not at Physio podcast. I'm your host, Jenny Resmondo, owner of South Alabama Physiotherapy and creator of the Not at Physio, where life should be fun and light. This is the podcast where we talk about how to keep the active adult who's busy with work and family life fit and healthy to enjoy the Gulf Coast outdoors. Let's get into today's episode. Before we start today, I wanted to let you know about our free Facebook group, the Not at Physio. I do live trainings in the group each week to dive deeper into strategies to remain active and where you can ask me questions personally and I'll give you feedback. Okay, on to the episode. Hey everybody, welcome to the Not at Physio podcast. On today's episode, we have a very special guest, Dr. Sarah Gibson, also known as the Dizzy Doc. Welcome, Sarah.
Thank you, Jenny. My pleasure.
So for those who are in our listening audience, why don't you give them a little bit of a background of who you are and why you're known as the Dizzy Doc?
Hi, Jenny. Thank you. So I am Dr. Sarah Gibson. I am a doctor of physical therapy and been a PT for about 18 years. Started off as a rehab specialist, a vestibular rehab specialist. My first job, they needed someone to learn how to do vestibular rehab. So thankfully, they trained me in that, and I started doing that. And then carried on until about maybe 12 years ago. I got an up close and personal experience with dizziness myself, with a specific type of dizziness coming from your neck and TMJ. And so learned a whole different facet of dizziness. So now I'm a manual therapist and a vestibular specialist, which molds well for this particular diagnosis of cervicogenic dizziness. But since I know the background in vestibular rehab, any kind of dizziness, throw it at me. And I'm happy to talk dizzy all day with anybody.
Oh, wow. So you said a lot of things that the listeners probably have no idea what you meant by. So let's see if we could kind of back it up a little bit and maybe break it down. So
Sure.
you said that you first of all you had issues that kind of led you down this current pathway. Do you mind speaking to that just a little bit?
Sure. So, about 12, 13 years ago, I just woke up. I'd already been a vestibular rehab specialist before. And then about 12, 13 years ago, I woke up one morning, 6 a.m., with just everything spinning like a top. I quickly, laid down, did the Dix Hall Pike, which is a maneuver we use to check for BPPV, and had my husband look at my eyes, and he's like, I don't know, they're going everywhere. So I was like, I knew it wasn't a stroke or, heart attack or something. I'm like, it's something with my vestibular system. So that's kind of where I was at. I was a vestibular specialist. At that time, I was also a manual therapy specialist. So that was PT using your hands to help people, with their bones, muscles, joints. And I didn't know anything about this other type of dizziness, really, called cervicogenic, originating from the neck. So I started learning all about that. It turns out that my dizziness was coming from my TMJ. So I had severe TMJ. Again, no pain even in my jaw, but apparently it was quite out of alignment. And the night before or the day before, I'd gone to the dentist, and that had kind of spurred this new onset of dizziness. So that's a very small faceted dizziness, like coming from your jaw. But we often see it in younger patients, 20 to 50 or something. And usually they don't get better with traditional vestibular rehab therapy. So it's a small segment, like 2.5%, they say, of all dizzy of the population, I guess, so the incidence in the population. But it's the type of dizziness that if it's not treated, won't typically go away on its own. It might kind of come and go for years until it's just all the time. So these people can be debilitated. So that kind of took me down a road of learning more about that diagnosis and learning how to treat it and self-manage it. And so that's become a big part of my population right now, probably 80% in the clinic I was just at. And now I'm starting my own clinic, so I'll be doing more of it there. So yeah, it's a long story probably, but that's my dizzy road.
Yeah. Well, I think that it will resonate with a lot of people because like here, I'm a physical therapist and a lot of people that come through my office, they have this dizziness and they don't have any idea that it's coming from their neck.
Right.
They just can't even fathom how that would happen.
Right. So basically what happens with the neck dizziness is, there's little proprioceptors, we call them, in your neck, and they give information to your brain. So that brain takes information from these proprioceptors, from your eyes, and from your vestibular system. So those three areas come together in the medulla. The brain makes sense of it all and can understand your position in space. But those proprioceptors can get thrown off for a lot of reasons. So basically, posture is a big one. If we're slumping and our posture, our head's forward, that's the biggest one, puts a lot of strain on the jaw and on the neck. So we look at, restoring posture, talking about triggers, what stress is, how are we sleeping, all these things.
Yeah. And then the other thing that you mentioned is that it could come from your jaw. You said TMJ. So some people will know exactly what that is, but can you talk about that some too? What is the TMJ?
Sure. So temporomandibular joint is right here, okay, between the mandible here and the ear. And what's basically happening, how the condyle sits on your face, right in that joint, okay, right under here. And so there's proprioceptors in that joint as well. And that also communicates and helps to align your upper cervical spine. And so if your head is like in a forward position, that puts compression on that joint, it can alter the input basically to your upper cervical spine and to your balance center in the medulla, and that can throw off your dizziness. So it's a very vaguely understood area basically, but even though it's in theory very hard to understand why it's happening, the treatment is pretty easy, which is great. So working on, it's a multifaceted treatment, but it's not hard. I always tell people, like, it's massage and posture and stretches and feel good things. So people really like the treatment for cervicogenic dizziness. And then I also do a lot of the vestibular rehab, and I know as you as a talking with your anglers, the motion sickness dizziness too is a completely different type of therapy, but very effective as
Right.
well.
Yeah. So the vestibular system is just the fancy word for what keeps our balance. Is that pretty much it? Or is there something
Yeah.
else that you might could relate that to?
Yeah, so a vestibular system, so it's basically like an organ like anything else, right? And it relays information to your brain about your body's position and space. So we've got these different otoliths in there, little crystals, we call them, pieces of calcium that move when you move, basically. When your head moves, they move. And or when your body moves, they would also move. And
Mhm.
this relays information to the brain. And then the
Mm.
brain combines that with what the eyes are telling it. Okay, so your vision is also giving input to the brain. So the eyes and the ears, and then these proprioceptors we talked about already, in the joints around the neck and whatnot too. So
Right.
it kind of, the brain synthesizes everything, and it's a very complex mechanism. But again, the treatment is not complex. So that's what's so awesome. It's easier to treat this for me than low back pain, or better prognosis than knee pain.
Yeah.
So
Yeah.
I love
And
it.
it's a big deal. I mean, how many people that do you encounter, and you probably a lot, but out there in our audience that are listening today, is how many times have you had a friend or family member that had to stop their entire life because they woke up with vertigo, with dizziness?
Yeah,
And
it's
so,
huge. It's huge. I mean, I think the
yeah,
incidence of dizziness, right, is like 30%. It's the third most common reason people will go to see their doctor. And some people just get it kind of coming and going, not a big deal. And again, if it becomes worse over time or progressive in nature, then that will cause them to seek help. And unfortunately, it is complex, and a lot of times it gets misdiagnosed or underdiagnosed. And people will suffer for years, before treatment, which is very effective in a few visits, usually symptom relief. So it's wild to me that there's it can be so debilitating, yet the treatment is not complex. So yeah, it's a interesting thing.
right.
Right.
And then something else that you said just a moment ago is that the motion sickness that people experience is a type of vestibular problem. It's just from a different cause. It's not coming from your neck. Can you talk about that a little bit more? Because I know a lot of our
Yeah.
audience, they have a motion sickness or seasickness, they can't go out on the boat, or maybe their family members can't go out with them. So it's kind of a big deal.
It is a big deal. And it's so interesting, motion sickness. It's so much fun when you look at kind of the progression of it too, and how it varies over the lifespan. We look at infants, and you'll put them in their swing for 2 hours, when they're crying,
Right.
and
And
they're
they're
happy.
fine.
They're happy as a clam. So their system's still developing, and at that point, your brain doesn't really know what normal is, because you're always getting tossed about. If you think about being in the womb, you're always moving, and motion is almost normal at that age. And then usually around age 2 is when they start to see some motion sickness develop in the children. And that kind of progresses and gets peaks around like 9 or 10, and then it kind of wanes a little bit into teenage years. And then there's another peak around like childbearing age, and then another peak around menopause for women anyway. And then as we get older too, sometimes the whole balance system is starting to you get progressively weaker, so it needs to be strengthened. So it's kind of fun just looking at the progression, how it changes over time. And um
Mhm.
but what's most exciting to me is that it's treatable. At any age of the game, you can treat it. And I think a lot of people don't know that. They might just take some medication, and that's fine if you're just occasionally going out on a boat or something, like once or twice a year. But if it's a hobby, that's regular pastime, or if it's part of your job, it can be really debilitating. So at that point, I think it's worth seeking treatment. um,
Yeah.
it's basically the eyes. So if you're on a boat, what happens sometimes, so there's this perceived motion in your joints, because your
Mhm.
proprioceptors are also in all your joints, your knees and everything else, are telling your brain where you are located in space, and including your vestibular system in your head. And then your eyes are saying something different, especially if you go under deck and you're not really seeing the horizon. Your eyes aren't getting good input about your visual field, and so there's conflicting input to the brain, and then you get dizzy. So we can do a lot of things to help with that, just practical things, trying to look at the horizon and focus
Yeah.
on something that'll help the brain. Or if you're in a car, certainly driving's easier because you know what's coming, versus the passenger where you don't know what's going to happen. So it's unexpected motion that the brain doesn't know was coming. So it's really interesting.
Right. You're describing me to a T when it comes to motion sickness. Everything you've said quite along the ways. I'm like, yep, that's me. Yep, yep. Check that off. Yes, yes, yes.
Let's sign you up. We'll sign you up tomorrow.
It's
I'm ready.
all the it's all yeah. It's all the fun things that people who have motion sickness have to deal with. And you have a solution that could help a lot of people. That's like you just said, is extremely easy to do.
Right. I
It's
mean,
just
it is and it
you got to
isn't.
know
Like
how to
it's
do it.
yeah. So it's tricky. So it's easy, but at the same time, it might be nauseating, which is why people don't do it. Right. So, um, so the vestibular rehab treatment is actually habituation, which is getting yourself dizzy. So that's
Yeah.
how we get over being dizzy, is by repeatedly getting dizzy. And that then tells the brain what the problem is. So the brain can't fix what the brain can't see, they say. So, if
Mhm.
you just are taking some maclazine or taking your antihistamine that's non drowsy, or that's the drowsy type, apparently, the drowsy antihistamines work on this too, like Benadryl or whatever. But if you're just taking those medications, it's a good short term fix, but you're kind of dulling down the vestibular input. So the brain doesn't know there's a problem. And then next time you go, you've got the same problem. So if you really want to fix the problem, you have to keep showing the brain the problem, and
Right.
over again in a repeated way. And then it's like, oh, I see what's going on.
Yeah.
It's going on
Yeah.
over here. The left ear isn't working as well as the right, or whatever's happening in your particular body. It's oversensitive input. you know so the brain will desensitize and habituate to the problem. So it's not fun treatment, but usually what I tell people is, like, have a scale 0 to 10. And if
Mhm.
10 is you're throwing up and 0 is you're fine, you don't want to go too far over like a 4 or 5 with the exercises. And then you kind of
Right.
get yourself a little dizzy, and then you take a break. let that come all the way back down to zero and then try it again. And you
Yeah.
do that 10, 15 minutes a day, twice a day, probably. And you see
Yeah.
results.
So interestingly enough, is you and I are in a coaching program together, and our coach has actually hired you to help him out with his family member. Just generally speaking, what has that changed that you helped them? What has that meant to them, and what have they been able to do now that you've worked with them?
Excellent. Yeah. So it's kind of cool because our coach is also a therapist. So when I got to see his wife and meet his wife for the first time, someone was actually telling me that she was suffering from dizziness. And I was like hearing about it and just knowing her age range and whatnot, I had a hinting suspicion that she might have this specific, and she couldn't, she wasn't getting better over years of having this. So those
Mhm.
are the two things you kind of, based on age and other people have tried to help and they're not getting better, then you think it's most likely this other type, cervicogenic, has a component that hasn't been addressed. So I was able to just look at her neck very quickly and realize that she had what I call the dizzy spot. I just
Yeah,
made this term up, but right behind, someone will probably find it
yeah,
on
yeah,
now, but right right back here at the root of your SCM, where it inserts into your ear, right behind your ear there. It can get very tight, and
hmm,
that could be because of a head tilt, which could be the number of reasons causing that. Maybe hearing loss in one ear, and you're compensating. I mean, it could be a myriad of reasons. But just correcting the head tilt to the upper cervical spine is almost immediate relief, and that can last for a period of time. And so you have to just keep working on that then with different modifications. How are they sleeping? Are they on two pillows, or they on their side, which is a big issue for TMJ patients. So just knowing all their little factors in their subjective history, we call it, then you can tweak those out and fix the problem. So ironically, it's pretty interesting. So all these dizziness things go together. So if you have one type of dizziness, like cervicogenic dizziness, you might also be more intolerant of riding on a boat. So, um, like if you just have one of those things by itself, you might be fine on the boat for 30 minutes. But if you have both things, well, you can't even tolerate the boat for 10 minutes or something like that. They kind of confound each
yeah.
other. So with his wife, what happened, I worked on her neck, and because of that, her dizziness was resolved, and she was able to then go on the boat for an hour or something, so which she hadn't done, which was great. So he was so thrilled. But it was interesting because she had done vestibular rehab without success,
Yeah.
to help with the motion sickness perhaps, but she hadn't had the root cause, which was the cervicogenic. So anyway, it often gets missed, and it was pretty cool to be able to put the two things together for her. So yeah, it's
That's
fun.
super exciting. I was hoping that our listeners would be able to appreciate that, and maybe some of them would recognize the same symptoms. So that being said, we're running short on time. I know both of us
Yeah,
have other obligations that we've got to run off to, but maybe we could continue this on another episode. I'd like to go into more details and just help as many people out as we possibly can. But if
excellent.
people want to find out more information or to be able to reach you to get more information, what's the best way for them to find you?
Excellent. Thanks, Jenny. Yeah, I'm still developing my website, etc. But the best way just to reach out would probably be just give me a call. And I have, I can go to voicemail if I'm not available, but that's 716 So 716-340-4747. Or they can email me at Dr. Sarah, Sarah, at thedizzyDocPT.com. So dr at thedizzyDocPT.com. And then I would love to chat more and yeah, just to help problem solve. I think diagnosis is the hardest part. There's a million people that are treating this, but yeah, just getting a good diagnosis first is the most important step. Thanks, Jenny. It's
Awesome.
been so much fun.
You're awesome. I'm so glad that you came on. And for those of you listening, I'll be sure to include all of her contact information in the link to the video. So you'll be able to have her phone number and her email address if you'd like to reach out to her. And as always, like and subscribe, and we will see you next time on the Not a Physio podcast.
Awesome. Thank you, Jenny. My pleasure.